So if we look at the familial or idiopathic types of cardiomyopathy, sometimes called the primary cardiomyopathies that we see in cats, it's similar to what's described in humans. So the classic forms of hypertrophic, dilated, restrictive and arrhythmogenic cardiomyopathy are all described in both humans and in cats. So of all the different types of cardiomyopathies, hypertrophic cardiomyopathy is the most important and the most common. And hypertrophic cardiomyopathy is characterized by thickening of the left ventricular walls, so there's left ventricular hypertrophy. The next type of cardiomyopathy is restrictive cardiomyopathy, where the left ventricle can look relatively normal, but there's dilation of both atria. Then dilated cardiomyopathy is very similar in cats to that seen in people and in dogs, and it's characterized by poor systolic function, and often all four chambers of the heart are dilated, and certainly the left heart is dilated. Arrhythmogenic right ventricular cardiomyopathy predominantly affects the right heart, and there can be substantial dilation of the right atrium or right ventricle. It's often accompanied by arrhythmias. Because we can't always identify the underlying cause, sometimes we prefer to talk about a phenotype. So we'll talk about an HCM phenotype or a restrictive phenotype or dilated cardiomyopathy phenotype. Generally, arrhythmogenic right ventricular cardiomyopathy is somewhat different to the other forms, but within HCM there's quite a wide range of different types of phenotype. So there can be severe extensive hypertrophy or relatively little hypertrophy. And in some cats they develop what's called an end-stage form of HCM, where systolic dysfunction develops, and sometimes they'll develop dilation as well. So there is some overlap between the different types of cardiomyopathy, and with restrictive cardiomyopathy, for example, it can look very similar in some cats to cats with HCM who don't have very much hypertrophy. Likewise, if systolic function is a little bit reduced, it can look like an end-stage form of HCM. With dilated cardiomyopathy, again, there's overlap with end-stage HCM because both have systolic dysfunction. So it can become quite difficult to sort out exactly which type of cardiomyopathy we're talking about, even for experienced cardiologists. When you add on top of that the fact that different causes of hypertrophy can be difficult to distinguish just on the basis of how the heart looks. So hypertension, acromegaly, hypothyroidism can all result in an HCM phenotype. You can see it's quite difficult sometimes to sort out exactly what type of cardiomyopathy you're looking at just from an echo. Even with dilated cardiomyopathy phenotypes, if we know that dietary taurine deficiency can result in a similar phenotype, and also having long-standing uncontrolled tachycardia, such as with ventricular tachycardia or supraventricular tachycardia, you can end up with a phenotype that looks identical to idiopathic dilated cardiomyopathy. So it's quite complicated, and we're not very good at subclassifying the different types of cardiomyopathy. So this is not something to get too concerned about when you're wanting to treat a cat with heart disease.